1. Trump administration's $50 billion plan to save rural hospitals. 2. Trump's $50 billion healthcare push, impact on key stocks and ETFs. 3. Is Trump's $50 billion enough to save rural healthcare? 1. Trump administration's $50 billion plan to save rural hospitals. Imagine the shockwaves that will ripple through rural America as the Trump administration rolls out a staggering $50 billion plan to rescue struggling hospitals. But here's where it gets controversial. While this move might seem like a lifeline, it's also a stark warning of the challenges ahead. Lawmakers from both sides of the aisle are raising red flags, especially for those living in rural communities. Let's dive in and explore the details. The Trump administration is in a rush to establish a massive rural healthcare fund, aiming to bolster hospitals that are teetering on the edge of collapse. This initiative is set to kick in before significant Medicaid cuts take effect in 2027. Dr. Mehmet Oz, the newly appointed administrator of the Centers for Medicare and Medicaid Services, CMS, is leading the charge. Oz, who was handpicked by former President Donald Trump, sees this fund as a crucial part of a larger mission to revitalize rural healthcare. "We're moving at lightning speed," Oz declared, emphasizing the urgency of the situation. He envisions a future where innovation is at the heart of rural healthcare. The goal? To train more healthcare professionals and get them into underserved areas. Oz wants to see a more engaged healthcare system, with a broader range of providers stepping up to the plate. This ambitious plan, dubbed the Big Beautiful Bill by Trump, comes at a time when a Congressional Budget Office (CBO) report paints a grim picture. The report warns that as many as 11 million people nationwide could lose their Medicaid coverage in the coming years. This is due to a combination of eligibility redeterminations and planned budget cuts. And this is the part most people miss: rural communities are particularly vulnerable. Hospital closures in these areas have been on the rise, and the proposed $50 billion fund is seen as a temporary fix rather than a long-term solution. According to the Kaiser Family Foundation, a staggering 44% of rural hospitals are currently operating at a loss. While the new fund is a step in the right direction, it's important to note that it will only cover about one-third of the expected shortfall caused by Medicaid funding cuts. Senator Josh Hawley, Republican Missouri, has introduced legislation to expand the Rural Hospital Fund over the next 8 years, aiming to ensure that these hospitals never face cuts again. Democrats, however, are not convinced. They accuse Republicans of trying to downplay the impact of these cuts. For any Republican that's been saying, "Oh, these weren't actually cuts to Medicaid," it shows a lie to that, said Representative Ted Lieu, Democrat, California. The debate is heating up, and it's clear that this issue will spark some intense discussions. Starting in September, states will be able to apply for the new rural healthcare funds. However, Dr. Oz has not specified which hospitals or regions will be prioritized. This lack of clarity is just one of the many questions that need to be answered. So, what do you think? Is this $50 billion plan a game changer for rural healthcare, or is it just a band-aid on a much deeper wound? Share your thoughts in the comments below and let's get the conversation started. Your voice matters, and we want to hear from you. 2. Trump's $50 billion healthcare push, impact on key stocks and ETFs. Imagine this: President Trump's latest social media bombshell could be the game changer for healthcare investments. Dive into the details and elevate your investing strategy with TipRanks Premium at a jaw-dropping 50% off. https://lp.tipranks.com/half-a-year-2025-premium/?LLF=RSS ampersand timer =on ampersand coupon HY25P50 per. Gain access to top-tier investing tools, comprehensive data, and expert insights to fortify your investment decisions. Don't miss out on TipRanks Smart Investor Picks, delivered straight to your inbox weekly. https://lp.tipranks.com/half-a-year-2025-sis/?LLF=RSS ampersand timer =on ampersand coupon HY25P50 per. Here's the scoop: President Trump, https://www.tipranks.com/stocks/DJT, recently took to Truth Social to drop a major announcement. He declared, "Americans are well aware that we a superior healthcare system to adequately serve our magnificent communities, which the radical left Democrats have callously abandoned. That's precisely why Republicans have allocated a whopping $50 billion in the One Big Beautiful Bill aimed at bolstering our most vulnerable hospitals, especially those in rural areas. Shockingly, every Democrat voted against this crucial funding. I extend my heartfelt thanks to all the Republicans in Congress who tirelessly worked to make this historic achievement a reality. Our nation shares its gratitude, too. But here's where it gets controversial. How will this bold statement ripple through the stock market? This recent post has the potential to shake up the stock market significantly. Why? Because Donald Trump's powerful statement could spark a surge in investor interest in healthcare stocks, particularly those linked to rural hospitals. Companies like Community Health Systems, HCA Healthcare, and Tenet Healthcare Corp might see a notable boost. The promise of substantial funding could also positively influence healthcare-centric ETFs, https://www.tipranks.com/ETF, such as the Healthcare Select Sector SPDR Fund and Vanguard Healthcare ETF, as investors eye potential sector growth. However, the political friction highlighted in the statement could introduce market volatility, impacting broader market sentiment, including biotech-focused funds like the iShares Biotechnology ETF. Let's break down some of the key stocks and ETFs that might feel the impact. Community Health Systems, CYH, https://www.tipranks.com/stocks/CYH. HCA Healthcare, HCA, https://www.tipranks.com/stocks/HCA. Tenet Healthcare Corp., THC, https://www.tipranks.com/stocks/THC. Healthcare Select Sector SPDR Fund, XLV, https://www.tipranks.com/ETF/XLV. Vanguard Healthcare ETF, VHT, https://www.tipranks.com/ETF/VHT. iShares Biotechnology ETF, IBB, https://www.tipranks.com/ETF/IBB. Disclaimer and disclosure, https://www.tipranks.com/glossary/d/disclaimer-disclosure, report and issue, https://www.tipranks.com/glossary/c/contact-editor. And this is the part most people miss. Could Trump's statement be a double-edged sword, bringing both opportunities and uncertainties? What's your take? Agree or disagree? Let's hear your thoughts in the comments. 3. Is Trump's $50 billion enough to save rural healthcare? A $50 billion lifeline has been thrown to rural hospitals, but will it actually keep them breathing? Here's the uncomfortable truth that has health experts nationwide deeply concerned. During July 4th celebrations, President Trump signed legislation approving historic cuts to federal healthcare spending. To soften the blow for rural providers, Congress allocated $50 billion specifically for them. But here's where it gets controversial. That rescue fund represents just one-third of the $155 billion in rural Medicaid cuts happening over the next decade, according to independent analysis by health policy researchers at KFF. I have far more questions than answers right now, admits Alan Morgan, CEO of the National Rural Health Association. Nobody truly knows if this bandage is big enough. This uncertainty stems from a brutal reality: rural hospitals treat vastly more Medicaid patients than urban facilities. Yet the new law slashes over $1 trillion from Medicaid nationwide, cuts disproportionately funding tax breaks for the wealthy. Was redirecting money from healthcare for low-income families the right approach? That question sparks fierce debate. The $50 billion fund was essentially a political compromise, a concession to secure vital votes from moderate Republicans like Alaska's Senator Lisa Murkowski. Why did she hesitate? Because 1 in 3 Alaskans depend on Medicaid. It's frustrating when careless, rushed decisions have lasting consequences that fall on us, not lawmakers, vents Jared Kazan, head of Alaska's Hospital Association. He sees the fund as a sidestep, not a real solution. And the pain won't be shared equally. More than half the rural Medicaid cuts target just 12 states that expanded coverage under the Affordable Care Act: Illinois, Kentucky, Louisiana, Michigan, Minnesota, Missouri, New York, North Carolina, Ohio, Oklahoma, Pennsylvania, and Virginia. Kentucky alone could lose $12 billion, a devastating blow where Medicaid covers half of all children. State officials are anxiously awaiting federal guidance, knowing 1.4 million vulnerable Kentuckians hang in the balance. So how does the $50 billion Rural Health Transformation Program actually work? It distributes $10 billion yearly from 2026 to 2030. States must apply by year-end with detailed spending plans. Funds can support ERs, maternity wards, staff recruitment, ambulances, telehealth, addiction treatment, or preventive care. Half is split evenly among participating states. The other half is doled out by CMS Administrator Dr. Mehmet Oz based on rural population and need. But here's the kicker most people miss: this fund doesn't come close to replacing lost Medicaid dollars. It's a chance to rethink rural healthcare delivery, Morgan argues. If done right, it could reshape rural America's future, but that's an incredibly tough ask. States must now innovate with fewer resources while 44% of rural hospitals already operate at a loss. Controversially, the definition of rural is getting fuzzy. Dr. Oz reportedly assured representatives from less rural districts they could access funds. Pennsylvania Representative Rob Bresnahan expects money flowing to his area, which includes cities like Scranton, by early next year. Morgan anticipates a mad dash to claim rural status, wryly noting, "We're all rural at heart when it comes to money." Do you believe redirecting Medicaid funds toward tax cuts was justified, given the impact on rural communities? Should urban-serving hospitals and suburban districts qualify for this rural fund? Share your take below. This debate affects healthcare access for millions.